year's Anti-Poverty Week. My name is Trav McLeod. I'm Executive Director of Brotherhood of Laurence. Before we begin, I would like to acknowledge the traditional owners of the land. For me, that's the Wurundjeri people of the Kulin Nation. And I'd also like to acknowledge the traditional custodians of the various lands we're joining from today. And on behalf of everyone, pay our respects to elders past and present. And I want to extend that respect to Aboriginal and Torres Strait Islander people who are with us today as part of this webinar. I'd also like to call out that it's been a pretty grim week. It's been a difficult time and a very difficult week for First Nations peoples. The result of last weekend's voice referendum was not what we at BSL or millions of supporters were hoping for. And I know many people who are watching this webinar today worked incredibly hard on the Voice campaign, and that the theme of Anti-Poverty Week was chosen specifically to support Voice, Treaty and Truth. As others have said, we remain committed very much to working with and supporting First Nations peoples, organisations and allies in the months and years ahead to find a path to a better and fairer future. Before I introduce our panel for the webinar discussion, I'd also like to acknowledge and thank our captioning and Auslan interpreters for today. So Sharon, Sarah and Alex, thank you for making this webinar more accessible. To make the session as interactive as possible, please do send any questions through the Q&A function at the bottom of your screen, and we'll come to as many of those as we can later in the discussion. So today we are discussing ending child poverty, and I can't think of a better panel to have this conversation with than Professor Sharon Goldfeld, Myra Geddes and Emily Lightfoot. I'm going to introduce them now and then set the scene for the discussion. So Professor Sharon Goldfeld is a paediatrician and Director of the Centre for Community Child Health at the Royal Children's Hospital in Melbourne, as well as being Co-Group Leader of Policy and Equity and Theme Director for Population Health at the Murdoch Children's Research Institute. As an experienced policymaker, public health and paediatric researcher, Sharon aims to ensure ongoing, effective, rapid translation of research into the policy and service arena. Sharon's also on the advisory panel for the Commonwealth Government's Early Years Strategy. Welcome, Sharon. Myra is another highly experienced and esteemed expert in the early years. Myra is the Social Impact General Manager for Good Start Early Learning. And in that role, Myra oversees Good Start Social Impact Strategy, policy measurement, research and evaluation, and Good Start Social Inclusion programs and initiatives. For many years, hello Myra, she's been a driving force of social policy and reform that has helped to transform and improve the quality of life for thousands, millions of Australians. She's become, or has been, the Senior Social Policy Advisor to 2 Australian Prime Ministers and has worked across early childhood education and care, schools, community services and health policy at state and national level. Wonderful to have you with us, Myra. And Emily Lightfoot, our third panellist for today, is a university-educated accountant. Emily runs a small business as a part-time tax accountant, but due to health reasons can't work full-time and has been on job seeker for several years. Emily's a single mum with a teenage son. They live in private rental property in regional New South Wales, which is becoming increasingly unaffordable. So thank you to Emily, to Myra and to Sharon for being with us today. What I'd like to do is set the scene for our discussion before diving into questions for our panel. So as you saw on the slides when you joined the webinar, today in Australia, around 760,000 children, so 1 in 6 young people, are living in poverty. That's a number that would fill up the Melbourne Cricket Ground, which is only a few kilometres from where I'm standing, more than 7 times. Quite a bit more than 7 times, given the size of kids. It's a staggering number, given Australia is one of the richest lands on the planet, and we're in the top 2 countries in the world for median wealth per person. Poverty is complex and has deep roots. We don't have an agreed set of measures for poverty nationally, but one measure often used is 50% of median household income. Alongside this staggering number of children experiencing poverty and disadvantage is the number of children who have developmental vulnerability. So Social Services Minister Amanda Rishworth reminded us of these challenges at the Early Years Summit in February. She told us that there are over 1.5 million children aged between 0 and 5 in Australia today. And a new child is born every minute and 43 seconds. She also said that since 2021, when the latest data from the Australian Early Development Census was available, we discovered for the first time since 2009, around 45% of Australia's children are experiencing higher rates of developmental vulnerability. We know the early years are critical for the development of children. These years are the launchpad for life. Research has shown that 90% of a child's brain development happens before they are 5 years old. Allowing these children to continue living in poverty as a policy choice should really be unacceptable to all of us in a wealthy country like Australia. It's a very busy time for the early years reform agenda. Last month, the South Australian Royal Commission into Early Childhood Education and Care handed down its report, and it added to the incredible body of evidence that investing in the early years from birth to school pays enormous dividends. The Royal Commission also highlighted how children experiencing disadvantage are the least likely to access early childhood education and care, yet are also the children most likely to benefit from it. A couple of weeks ago, the Commonwealth Government's employment white paper said that a key pillar of Australia's skills agenda into the future was charting a course to universal early childhood education and care. And also in the last couple of weeks, the ACCC has released its second interim report for its inquiry into the costs of childcare in Australia. And among its many findings, the ACCC found that the current activity test for the childcare subsidy means that low-income families face a much higher proportion of out-of-pocket costs for early learning. They recommended removing or substantially reforming the current activity test because it's a barrier to more vulnerable children accessing care and creating a barrier for their parents to enter the workforce. So hopefully that sets the scene for the discussion to come. We know that everyone benefits from a better early childhood system and better outcomes for children no matter where they live, and that there are no drawbacks to helping all children to start better and making this country a better place to be a child and to raise one. So let's start with you, Sharon. You've been an esteemed expert in this area for decades. You're a member of the Commonwealth Government's Early Years Strategy Advisory Panel. I'd be very grateful if you could explain to our audience where that process is up to and how poverty and disadvantage are going to be addressed through that strategy, as much as you're able to say, given the strategy has not been released. And maybe say a little bit about those other releases that I mentioned, the South Australian Royal Commission, the ACCC report, and what that means for reform in the early years. Over to you.
Thanks so much, Trav, and thank you to everyone. I actually am coming to you also from the lands of the Wurundjeri people and pay my respects to elders past, present and emerging. And also just acknowledging everybody here in the room. As you've said, Trav, it's a tricky time for everyone for a whole range of reasons. So I wish I could sort of be a little less sobering than I'm going to be, talking about kind of what's been happening in Australia. But I will start with something a little bit more upbeat, which is to say, in my experience in the policy environment for all this time, this is probably the most amount of energy, effort and convergent agreement there has been across states, territories and stakeholders across a whole range of platforms around early childhood. And when we were doing this, probably in the first kind of 10 years of this century, there was a sense that we really had to battle for why early childhood was important. I feel we've won that battle. I feel that people really do get that early childhood is important. And now we're in the much more exciting place, which is, well, if that's the case, what do we actually do? And to me, that feels much more advanced and much more hopeful. And as you've noted, there's a number of different things happening at Commonwealth and state levels, and I'm not going to rattle all of them off, but, South Australia's had the commission, but actually a number of states are making, big commitments, particularly in preschool and early childhood education and care platforms about what they might do for children, and a real recognition that this is the time we need to put the effort in. The ADC results are interesting. We haven't shifted inequities for Australia's children, actually, since we've started the ADC and started measuring it. It was in 2009. So that's I think, very sobering. 2021, they got worse for the reasons you can imagine. So it feels like we've got a bit of a burning platform to do something. And I feel we've got some great kind of in that burning platform, some great irons and fires, maybe, if I can keep going with the analogy. So there's all the things you mentioned, but I might mention a few more things that I think are worth saying. So the early years strategy, if you like, I suspect we'll be able to put a ribbon around all of these different opportunities. So, for example, the just to bring us all back down to earth, the intergenerational report really sort of said that in the next 50 years, if we kind of don't get it right for our society, we're going to be overwhelmed. Our healthcare system is going to be overwhelmed. And so it felt like, okay, that's the North Star. The North Star is we already have, by the way, children, particularly those living in lower income families, not going to live longer than their parents. That's the first time in history that we've seen that. And of course, so chronic disease and everything to do with chronic disease prevention, which is actually on the health agenda, is actually an early childhood issue. We also have the measuring what matters and the whole well-being, and the focus on the importance of things that aren't just about GDP. And of course, again, the importance of children, but also families and non-GDP kind of the importance of those as contributors to the economy. So actual parents are great contributors to the economy, not just employment, but actually in the non-goods and services things they do, looking after their children. And then there's also things like the Children's Safe and Supportive sort of policy, which is around prevention and child protection. There's the National Child Mental Health and Wellbeing Strategy, which is again talking about children. So there's a whole range of different strategies. There's a review of the National Disability Insurance Scheme with again a focus on young children. There's actually the National School Reform Agenda, which is again focusing on children. As all of these processes are often the case, they are somewhat separate. And we're hoping with the early years strategy, we can be, you'll excuse the Lord of the Rings analogy, but one kind of strategy to bind them all, where we can sort of try and work out how do these things all come together around children. And I think that's what the strategy is going to try and deliver on, at least try and articulate how these strategies all come around to children, what are the sorts of outcomes that we really care about, and what are the sort of opportunities from the Commonwealth's point of view. And I will say that the things that we're talking about today, which is about money, is not off the table. I'm not sure it's on the table, but it's not off the table. In terms of the strategy, where there's a recognition that material basics are part of the importance of children's lives. So that's kind of where that's up to. So I feel quite optimistic in terms of the energy that we're seeing from the policy environment and the energy we're seeing in convergent efforts across disparate stakeholders. I think it's about as good as it's been, and I've got great hope that we might see something come out of it. And I'll stop there because I could kind of yatter on for a while.
Well, thank you for adding that dose of optimism. I want to ask you in a moment about your current research into vulnerability and disadvantage, but given you've started with that bigger picture of rounding them out, I might go to Mara just to get your sense of the reform agenda. Both you and Sharon were involved intensively in 2008-9. Do you agree that it's the moment for the early years? And perhaps, Maya, if you touch on the employment white paper and what its call around universality in early childhood education and care means for the shape of the reform agenda to come.
Yeah, absolutely. Thanks, Trav. And great to be here today. And I will join in extending my respect to the traditional custodians of all the lands we're on, and anyone joining us who identifies as Aboriginal or Torres Strait Islander. And, I put yes on the weekend, but that wasn't yes for a day. It will always be yes. And, after this period of reflection, the journey will continue. And I do agree with Sharon. This is absolutely a unique moment in Australia's history in terms of the value and understanding growing beyond those of us on this call that have always known that the early years are when you can make the biggest difference to children, and the power and potential of investment in the early years to create strong families, strong communities, and ultimately the long-term economic and social prosperity, of our nation and where we all live. And that First Nations people were caring, educating, supporting their children for 65,000 years, and there's a lot that we can learn from their approaches as we move forward. We were absolutely thrilled that the employment white paper had identified universal access to affordable early learning as one of the priority areas. But I think the thing that's really important to call out, Trav, is that's not the only place where that's been identified. The Prime Minister's most significant election commitment was focused on early childhood education and care. It was the most expensive election commitment. It's been delivered. It's significantly improved affordability for families. And so that's great. We sort of really have this authorising environment that we haven't had and that we haven't seen in the past. Policymakers, people that don't typically focus on the early years, are now understanding and keen to find out about the early years. The ACCC has never done an inquiry into human services, and so they've just released their interim report, as Travis said, which has identified that in fact, some providers, and particularly not-for-profit providers, are doing a really good job of delivering high-quality, affordable early learning to children that are living in poverty. They've also identified that the current system makes early learning less affordable for children on the lowest incomes than for anyone else. And so then that's a question for government about that's not the policy outcome that we would want to see. And the Productivity Commission is really providing that appetite for change. And I think the key thread here that is being picked up and being reflected back to us from government, which is something people have been working on for decades, and which is this idea that the entitlements should be for children. If you're a child in Australia, you should be able to access the things you need to thrive. And, I work at Good Start. And so for us, that's really about early childhood education and care. And that's flipping the system to say that instead of saying how much you get to access something depends on what your parents or your carers do. If you change carers, your access goes down. Saying, no, actually, if you're a child in Australia, you should be able to attend up to 3 days of early learning. And then the connection there, obviously, to tackling poverty is if we want parents and carers to be able to participate in paid work or training, the access to the early learning and care should come first, not second. Anyone who's raised small children knows that having your children's needs met first is what frees up your mental and your physical capability to actually go and participate in those other things. A system that was designed that you had to do those things the other way around is not a system that's designed by people that have raised children and had to juggle, manage that juggle of raising young children. So it certainly is a unique time. On reflection from the result on the weekend, I think we can't be complacent. The evidence is really strong. We have a lot of appetite, but having said that, we really have to keep winning the hearts and minds, presenting the evidence, as Sharon has said, and then focusing on the small, simple things that actually really make a difference for children and for families. And so, removing the activity test, streamlining access for children, decoupling some of those participatory requirements that create barriers to families. There's a lot we can learn from the COVID period, when in early learning was just free for families, and families didn't have to go through Centrelink. If they came to our doors, we could open the doors and they could come in and they could access as many days as they needed. And what we saw, the evidence showed during that period, more children experiencing vulnerability came, and even the children for whom it was supposed to already be free, they actually came more often when it was free for everyone.
Fascinating, thank you. Thanks, Mara. And I thank you for sort of explaining how both through the ACCC report and also through, what you've seen through the COVID period at Good Start, how if we don't have those settings right and we don't have entitlements or guarantees that follow children, we can inadvertently create, compound, accelerate disadvantage in a way that that really doesn't befit a country like Australia. Sharon, I might come back to you then, because you're doing, a lot of research into sort of vulnerability and disadvantage in early childhood. And it'd be terrific to learn a little bit more about that, what it seeks to do and how you think it might make a difference.
Thank you for that. And yes, we continue to try and capture and understand the levels of disadvantage in Australia. I might just talk a little bit broader when we're talking about disadvantage as opposed to poverty. So poverty is a subset of disadvantage, but it's actually not all of disadvantage. And I just want to make sure that we don't underestimate the amount of disadvantage that we have in this country. So we've done some work kind of applying what we call social determinants lenses to understand true disadvantage. So that includes people's health, the risk factors, where they live, and the demographics and socioeconomic disadvantage. And when you start bundling all that up and understand that disadvantage wears many hats, so people can actually be disadvantaged for many reasons, then the levels of disadvantage in Australia are much bigger than you think they are. And I think that's really important, and so that we don't minimise that. The second is trying to understand where we can start making some differences. And the first thing I will say, which is probably not what everyone wants to hear, which is there are no silver bullets. I would love to tell you, and we've been particularly focusing on equity, so we're interested in the gaps in between disadvantaged and those who are not disadvantaged. And I wish there was a silver bullet, and I wish we could just say we just do this one thing and we'll solve it all. But there are no silver bullets, and that doesn't mean we shouldn't start thinking about the full stack that children need. And I do think we need to think about that full stack, and we've talked about it in different ways: children's rights, entitlements, etc. But if we're not thinking in that complex way about all the things that children and families need, my fear will default to the wrong side of complexity. So there's a saying, that I wouldn't give a fig, from Oliver Wendell Holmes, I wouldn't give a fig for simplicity this side of complexity, but I'd give my life for simplicity on the other side of complexity. It's tempting, isn't it? Just go, yep, let's just do this thing. We'll call it a policy. We'll give it a cool name, and we'll announce it. Done. And that's the risk, isn't it? And that's even in the risk in poverty. Not that I want to diminish it, but it is the risk. If we could eliminate poverty tomorrow, we're not necessarily going to eliminate all of the other disadvantages that sit around that. So I think we need to sit in complexity for just a little bit. And if I can give you an example, and I'll answer your question then directly. I spent too long talking to the media, I think. So we've been doing some work with the Commonwealth, who've been interested. So here's some blow your mind sort of thing. The Commonwealth has paid us, the Department of Ed paid us to do some work exploring a very wonderful data set, which was called MADIP, which I won't tell you what that stands for, because now it's called PLIDA, which is Person Level Integrated Data Asset, which is bit of a naff name if you ask me, but anyway, it is a wonderful data set and allows us to look at a whole range of things related to the census, tax file data, welfare data, and the Australian Early Development Census. And so we use that complex idea of what disadvantage means to have a look at what are the factors that were most associated with kids doing well or not doing well on the ADC. And the top three, two of the top three won't surprise you, the third one might. So the top three were parent education level. That makes a big difference. The second one is income level. that obviously makes a big difference. The third one, though, which is I think not everyone would think about, is the amount of time parents spend reading to their children. So that's kind of interesting, isn't it? So I think it tells us something about understanding the complexity of where we might need to kind of intervene. Now, the other thing about this report that's kind of cool is it's actually public. It's on our website. They've allowed us to publish it. And if any of you work with the Commonwealth, your eyebrows are probably raised right now. And the other is we've done another report looking in more detail that we're also going to be releasing, trying to look at what's most predictive of how kids do. So, and what group of things are most predictive, I should say. So I think I think I want to just be clear about the complexity of disadvantage. I want to be clear that even when we model giving people money, which we've done in a paper that we hope will get released soon, it doesn't eliminate the equity gap. It certainly makes a difference, but it doesn't eliminate it. So it's got to be part of our recipe. But if we cannot rest on the kind of just address poverty laurels, and we also, maybe I can talk about a bit later, need to be mindful that poverty is not a static feature of people's lives. Children and families go in and out of poverty over the life, and particularly depending on when they're having children and where they're up to. And Emily's probably got more to say about this than me. So we just need to recognise that if all we do is just capture people at one point in time, we're going to miss people who are at those edges. And so I think we need to be mindful of who do we really need to capture in a poverty addressing strategy, and in what way. If we're just going right to which, where are we going? Where's the cutoff, and what are our kind of thinking in that space?
Thank you, Sharon. I might come to Emily now. Hi, Emily. Emily, would you be able to tell us a little bit about your current situation for you and your son?
Yeah, sure. So I'm currently on job seeker payments. I've been on that for a few years because I have some pretty serious health problems. I'm actually currently in the process of trying to apply for the disability support pension. There's been a few barriers with that, financial, obviously. Access to medical services is a big one related to that, the cost of specialists, the unavailability of specialists. And, you know, I have to travel to a capital city, even though we've got lots of medical services in the regional city in which I live. There isn't any appointments available with the type of specialists I need for my application. And so just in order to apply for a payment that's going to give me an extra $100 a fortnight, you know, I have to incur significant expenses over a period of time to do that. I'm a single parent. I've got a 13-year-old son, and he has spent his entire life in poverty. So I grew up in I suppose, a middle-class family until I was about his age. And then my parents split. And so for my kind of mid to later teens, I was in a single parent family. But I can't say that I really noticed a significant change in my standard of living when that happened. So we're talking about here back in the early 90s, you know, through to the mid 90s. And, you know, my mother was on the sole parent pension. But we, you know, I can't really kind of recall where we really went without anything that was necessary. You know, we got the food that we wanted to eat, you know, that was nutritious. We didn't miss out on school excursions. We had, you know, school uniforms and clothing. You know, we went away on holidays. We had participated in extracurricular activities like sports and things like that after school. So, you know, all of those essential things were pretty much the same for, you know, myself and a lot of other children who came from, you know, who came from families where the parents were better off. You know, there were children that had additional disadvantage on top of what I had who weren't doing so well, but they were a lot smaller in number than what we are seeing now. You know, and I didn't feel that I had any real barrier towards accessing tertiary education or any career path that I chose. you know, I didn't feel that it was financially unavailable to me for any reason, or that there was any other significant barrier other, you know, I suppose, than my own personal development and psychology. But, you know, the situation that my son is now facing is the polar opposite of that. So he's basically going to have to go into the workforce as soon as he is legally able to. And the bottom line is that we just do not have enough money coming in to pay our basic expenses, our housing costs, our utilities, you know, our food. I mean, my rent just went up by $90 a week, and that is by no means the largest rent increase that, you know, people in my circle have had in this area. I've heard of other increases up to $150 in one hit. And yeah, and that situation is not going to get any better. The housing situation here is just at absolute catastrophic, you know, crisis point. There's a lot of people who've lived here their whole lives who are now finding themselves homeless. And yeah, so things are not looking real bright for us. You know, my utility bills, I'm behind in my utility bills because of my health conditions. I have to make sure that I have proper climate control, otherwise it'll exacerbate my health conditions. And even though I am, you know, on you know, I'm on a repayment plan to try and pay down that debt, I'm making use of, you know, energy assistance vouchers. Even with all of that stuff, I am still, you know, on this interim plan where I am not even paying it off at the rate that I'm accruing new charges. And the rate at which I'm paying it is unsustainable. Like, my income is just so low in comparison to what the actual cost of living is. You know, it's really hard to kind of communicate it to people who have the luxury of switching on a light without thinking about what it costs, or putting something in their trolley without thinking what it costs. You know, I really, you get put into this psychological state where you become hyper vigilant about everything. And that is because you have to pay attention to every single cent, every single dollar that you are spending, because if you put a foot wrong, it means that I won't have $5 or $10 to put fuel in the car to go to a medical appointment where, you know, I need something that's going to have a domino effect, or, you know, or some other issue that's going to come up. You know, if I need to, you know, take the cat to the vet or something like that. And, you know, most people think, okay, well, you know, just you know, put it on the credit card, or just, you know, use some of your savings. You know, we don't have that. We don't have that. We have no safety net. We have no buffer at all, because that has already been spent trying to keep our head above water financially. So yeah, and you know, one of the apart from just trying to get by day to day and, you know, maintain my situation so that the wheels don't completely fall off my life, probably the biggest single concern that I have is for my son's future, both his present and his future. He misses out on a lot of things. So he doesn't participate in any after school sports or anything like that, even with the, you know, the New South Wales government's active kids and creative kids vouchers. There's often out of pocket expenses that require purchase of equipment or additional, you know, fees and things to participate in things. Then there's transport costs to get there. You know, and it's no point signing up to something unless you can consistently commit to actually, you know, being there every week for training and for, you know, the matches on weekends or what else, whatever else you need to do. Yeah, so he kind of misses out on a lot. I mean, by his age, I'd, you know, been camping, I'd been skiing, I'd been to the ocean, I'd, you know, done all sorts of things. He has never seen the ocean. He has never seen the snow, even though we live, you know, within, you know, a day trip's distance from the snowfield, you know, and we've got a lot of services here to help us access that. he's never had that experience. And so there's all these things that, you know, people of my generation grew up with that we just absolutely took for granted, that he, you know, and other children living in poverty now just don't experience. And it's the type of thing that, you know, when I was growing up, you would expect it of people living in very remote areas in Australia, that, you know, a child may never have seen the ocean. And that's because they lived even in a very, very remote community in Western Australia or the Northern Territory or something like that. You know, I live in proximity to these things. I'm actually not, you know, not that far away. I'm 3.5 hours from, you know, the ocean, but the financial barrier of getting there, in terms of the travel costs, the accommodation costs, and yeah, what we would have to forego, which is things like rent and electricity in order to do that. Yeah, it just makes it completely, you know, unattainable. And the future that he's facing, like he is going to have to get himself in a position, if he wants tertiary education, he's going to have to pay for it himself out of his own pocket. I won't be able to assist him in any way with that. Yeah.
And
So
thank you for being so honest in describing your experience and your son's experience. Can I ask, you know, because you've talked about the big rental increase, which I understand is about 30%, whopping big increase. Myra talked about some of the things that were done through the pandemic period about particular services and income payments. One of those was the increase in job seeker during the COVID period. What difference did that make to you and your son?
It made an absolutely enormous difference. You know, that it's probably the first time in a long time where when that first you know, increased payment came in, where I could actually walk down the supermarket and actually put what I wanted in my trolley, you know, what I felt like eating, what I needed nutritionally, rather than just what I could afford. And to be able to, you know, there's a lot of dignity in being able to go to the supermarket and just buy things with your own money instead of having to resort to food banks. A lot of, you know, I think unless you've really experienced that firsthand, you know, you don't realize what a horrible experience it is, you know. And it's really great that there are those organizations out there that do help people. But yeah, I mean, back in that era, I could go shopping every week without having to resort to seeking those services. I, you know, got ahead on my bills. I paid my rent up a bit in advance, you know, because I was already, you know, used to living so lean, I was able to kind of do that. So I wasn't stressed, and, you know, I started to lose that hypervigilance about everything. But by the same token, we knew it was coming to an end, that it was only going to be temporary. Yeah, so
well, thank you for that. I mean, we know that the federal government lifted income support in the last budget and rent assistance, modest increases, but the evidence on the coronavirus supplement is really, you know, is really powerful. So it, you know, lifted nearly 500,000 Australians out of income poverty, including 75,000 children, and poverty rate for children of single parents were more than halved during that period.
And between lockdowns, I actually took my son camping for the first time. As a result of those increased payments. So it was a bit of a strange experience, because I realized, you know, that he had no idea how to put up a tent and take it down. And so the first day was a very, very long day. And, you know, I knew that sort of stuff by the back of my hand by his age. But I realized, that we had a bit of catch up to do with that.
Sounds like fun though.
Yes.
I mean, you mentioned access to support for people with disability, and I wanted to pick that up with Myra. We know Sharon mentioned that there's the review into the National Disability Insurance Scheme that's happening alongside a lot of the work in the early years, and that inclusion and early intervention for children with disability and developmental delay will be a huge focus, but has been very difficult to live out in practice. What would you and Good Start like to see so that Australia has a more inclusive and accessible early childhood system for all children?
Thanks, Trav. And thanks, Emily, for sharing your story. And I just can't resist, Trav. I think just want to acknowledge that people that are living in challenging financial circumstances like you, Emily, are some of the best fiscal managers our nation has to offer. The fact that in that period, you went, right, I'm going to get up, paid up on this, I'm going to do this, but you know what? Also, I'm going to do this thing with my child and go camping. I think there's a lot we can learn from people that actually genuinely have to make those really tough choices, and how, you know, given a bit of opportunity, the great choices that you make. So thanks for sharing that.
And can I just add to that? And I'm going out of panel thing, but just it flies in the face of a lot of the you know, the kind of fear mongering that people put out there when, you know, if we give people more money, they'll spend it on all these frivolous things and terrible things, and the whole world will go terrible. I just think we have to fight that as well. That is very paternalistic kind of attitude. If you give people money, they'll squander it, versus
Absolutely.
exactly what you're hearing from Emily. If you give people more money, they work out how to use it well, and gosh, they might even spend it on their children. Shock horror. And I think we have to be really mindful that we are having to counter that sort of narrative as well. And Emily, you're a great spokesman for doing that. Spokesperson, I should say.
So before I go back to Myra, Darren, spot on. It was 2 anti-poverty weeks ago, so 2 years ago, that there was a speech at the National Press Club with Tony Boone and also Andrew Charlton, who is the new member for Parramatta, former economics advisor to the Prime Minister, but he actually gave the evidence on what the supplement was spent on. And it was exactly the sorts of things that Emily has discussed: paying down bills, debts, utilities, supporting the family environment, and especially supporting children. That's a very powerful point. Thanks for reminding us. Myra, back to you on accessibility and inclusion in early childhood settings.
Yeah, and I think you know, there is a real sort of common theme even with the story that Emily was sharing, just in that inclusion has always been a foundation of what we do at Good Start. And as a not-for-profit social enterprise, we reinvest in ensuring we can provide inclusive services for children and families, and that of course includes children that have additional needs or disability. Because what we know is that there are additional costs that come with being inclusive, and if those costs can't be met, they are absolutely the door closes and you don't get to participate. So it's not that you necessarily, you know, can participate, but it's not as inclusive as it, you know, could be. It's like actually genuinely children miss out. And it's something that we've really focused on at Good Start. And, you know, in the context of the reviews that are happening at the moment, we do think there's actually a pretty good blueprint out there and some strong evidence about what do we actually need to do to provide really high quality inclusive early learning for children. And it really is just about meeting the costs of inclusion for those children. At the moment, government investment in many of those areas only partially covers costs, and you know, the ACCC has identified this as well, that, you know, not-for-profit providers make those reinvestments to provide that additional inclusion support for children. At Good Start, you know, we've tested a range of different models around this, and so when you think about what does that look like in a move to a more inclusive system, something our educators experience and centre directors experience is children and families who have stopped self-identifying that they have an inclusion need, because when they go to an early learning service, they're told, oh, sorry, the space is no longer available. And at the moment, there's a financial incentive for providers to do that because it will cost them money to include children. At Good Start, we're really proud. You know, we've had support from people like Sharon to look at which children do we retain, which children might drop out, and the cohort of children we are the best at retaining is children that have an identified additional need or disability. And that's because we really make sure they've got the support that they need within the service. We invest in the team around the child to make sure that everybody understands what the needs of the child and that family are. And I think the vision for the future is, Good Start's only 9% of the market, but there are many other fabulous high quality early learning providers that are doing exactly what Good Start is doing. But not every child has that opportunity. Not every child or family has that that service available to them. And what we've learned is it can actually be a really demoralizing process for families in trying to find that service. And so I think the vision for the future and out of the NDIS reviews and the other inquiries is, no matter where children in Australia live, in their local community, there should be a trusted service provider where they know that their child's needs will be met, and we can invest in that workforce that sits around the child to genuinely improve inclusion outcomes for all children. So when families are ready to access early learning, that's a positive experience for them, no matter what the needs of their children are, because we know otherwise, if families can't access early learning, that is a pathway to poverty if their parents don't feel that they can participate in work because they're not confident their child's going to get the care and support they need.
Thank you, Myra. We're going to come to some of the questions that have been posed in the chat now, and Sharon, there's one here for you, which I'll come to first, which is first of all a thank you for starting us off on a positive note, which we all need. But the question is, now that governments seem to be on side, how do we make sure that Indigenous children's poverty is prioritised without a backlash?
I really appreciate that question. I saw it and I thought, I hope we get to talk about that. So I first of all want to acknowledge the terrible social gradient that we have for our First Nations children in this country. And we should really all kind of hang our heads around that. It's just, it's pretty awful. And the closing the gap measures are really they're just the thin end of the wedge, really. But on the other hand, I also want to acknowledge the enormous strengths in Aboriginal communities, and in particular, the enormous strengths in family and community. And the reason I'm saying all of this is not to talk about poverty, but I just want to say there's lots of things we can do that is not about poverty as well. And I know I'm banging on about all of this. But I just want to say that acknowledge that addressing poverty is necessary, but not sufficient to turn around people's lives. And it's a great game changer, but it's not the only thing. And I just want to make sure that we look at it as a necessary, but not sufficient. But coming back to the issue for Aboriginal children, to me, that's a kind of a no-brainer, really, isn't it? I mean, I'll just share with you a little bit about the evidence about how we know money makes a difference to children's lives, because I think people don't always think about that. They just assume give money, magic happens. And in fact, there's quite a lot of evidence now trying to understand what is it about more money that makes a difference for children's lives in particular. And there's two big ways of thinking about it. And this is why I want to specifically focus on First Nations children. The first is what they call the investment model. And the reason I bring up about Aboriginal children, the investment model, I'll come to in a moment. But the investment model is that when you give families with children, and particularly young children, money, they invest it in things that are good for their children. And that's why we see changes in children's outcomes. So those investments might be anything from going camping, like Emily talked about, which is actually about spending time with your family, right through to better food on the table, more books, playthings, things like that, and more time with children as well, which we have to remember that investment in children is actually spending time with their family. And that is really important. And the reason I bring it up is when we had the baby bonus, there was a lot of, and that was giving families money. There was a lot of this kind of, I can only call it racist narrative, which was Aboriginal families are using it to buy televisions, which I actually think buying television is not a terrible thing, to be honest, but doing sorts of things, drug, alcohol. There was all of that, I think, quite racist narrative. And that's why I think it's really important that we don't go down this pathway of saying, well, we won't give them money because they'll spend it badly. That is actually the subtext narrative versus, gosh, if we can make a difference to any children in this country, surely we should be making a difference for First Nations children. And the other part of the evidence is actually about this family stress model. And so I just want to make sure that we're realising that giving people more money makes adults' lives less stressful, and less stressed parents actually are able to parent in a way they want to parent. And I just want to put those two things on the table, because for any families, of all the families in this country, surely it's First Nations families that we should be thinking about for both those things, the difference it makes to the adults in children's lives and the difference those adults can then make to the lives of their children. So it's a bit of a no-brainer. It's probably a long answer to the question, and now we're going to run out of time, but I wanted to put it in the context of what we understand.
Thank you. And there's a question there about how reducing poverty is not enough to impact disadvantage, which you might want to expand on in a moment if we've got time. My own view, and I don't know you recognise this, is we should be less squeamish at talking about poverty and the relationship between poverty and disadvantage. And there are some really good models overseas, New Zealand being one, where they've looked at it really closely, legislative measures around it that pick up intergenerational persistent poverty as well as income-related poverty, and they've seen dramatic reductions of child poverty, particularly for minority children. Myra, I just wanted to see if you wanted to add anything based on Good Start's experience in working with First Nations children and what that might mean in terms of an entitlement or investment.
Sorry, got to do that at least once, don't you, on one of these things? Absolutely, and I think that it's a two sort of track approach, which is valuing, celebrating Aboriginal Torres Strait Islander children and families, creating spaces where they feel they belong and safe to share. And then, some of the nuts and bolts around the entitlement. So it's great that now First Nations children in Australia have a universal entitlement to access early learning. That's something new that was only delivered this year. But gee whiz, let me tell you, the way they go about accessing that leaves a lot to be desired in terms of the engagement with Centrelink and all of those sorts of things. So, I think there is this risk of that kind of backlash, and as Sharon has talked about, some of that, the negative messages there. But through whether it's the campaign for the Voice or Reconciliation Week or NAIDOC Week every year, we are, by investing in children and by the work we do across all early learning services to acknowledge and celebrate our First Nations history and then remove barriers to access for First Nations children, I think we are laying some of that groundwork to shift that narrative longer term about why we should invest in First Nations children. As Sharon says, the evidence is there, but we've got to really bring those two pieces together about, the evidence about what we know works, and then, winning the hearts and minds of Australians that this is a thing that we should do, and we know it's going to make a difference.
Thank you, Myra. Emily, I want to come to you. I'm conscious we've got 4 minutes to go. And Sharon talked about the earlier strategy being able to tie a ribbon around this focus on children and families. And given how you've explained your story for you and your son, I wanted to say it must be frustrating to wait for an early years strategy, and we haven't even spoken about schools and concentrated for disadvantage in schools. But if you were the minister and you were putting the finishing touches on the early years strategy, whether it's Christmas or next year, what would you do? Where would you focus the investment, particularly the investment around addressing child poverty?
Well, it's a bit of a big ask, but I think that early childhood education should be made universal, unconditionally universal. So that means not just removing the financial barriers, but removing the other non-financial barriers to children's participation in early childhood education as well. So, and there's a number of non-financial barriers which really do need to be addressed. I think it should be voluntary, so not compulsory, because in some family situations, it suits a child and the family better to have different alternatives at that stage of their development. But definitely it should be universal in the same way that school is universal. So
thank you, Emily. That was a very crisp answer, almost like a press conference. Well done. That was terrific. We've got a little bit more time, so I can see that Myra was keen to answer the question around reading to children, about it being relatively easy, but in some cases it's not, and examples of where this is happening with families who need it. And before Myra does that, I'll just give a bit of a plug for the HIPPY program, the Home Interaction Program for Parents and Youngsters, which BSL brought to Australia. There's 100 sites around Australia and focuses on building a home learning environment for children aged 3 to 5 and their interactions with learning and childhood. Myra, did you want to answer that question very briefly? You're on mute, I think, Myra, potentially not coming through.
How's that? I was just acknowledging, so there are some great programs. It is hard, but I think that's where some great work happening in the community. So there's HIPPY, there's the Dolly Parton Imagination Library. But I think one thing that we can all do, and people who work with children, is breaking down those barriers to reading. So it can be borrowing books from early learning and then looking up a YouTube video of them reading the book. Sometimes parents aren't confident to read the book. Sometimes you're too tired because you've been juggling and doing all the other life things. So I really just wanted to acknowledge that it seems easy. It's not. Doing it consistently is hard, and that there are some programs out there to help. And you know, if all else fails, like pop into your local early learning centre or library and being able to take some books home, and then I would hop on Google and have a little look there.
Thank you, Myra. And
Raising Children Network.
Raising Children Network. Perhaps we can circulate some of these materials when we put up the recording. But look, I just want to thank our brilliant panel, Myra, Emily, Sharon. Thank you for sharing your expertise, your experiences, your insights. You know, this is really, you know, as we've said in other forums, Highway 1 on Australia's reform agenda, and we absolutely need to get it right because early childhood is the launchpad for life, and those numbers we've accounted up the top, they shouldn't exist for a country like Australia. So we need to do better, and happily governments are focused on this issue at the moment, as are others across business and the community. So hopefully we see some real momentum over the next year or two. Emily, I want to thank you especially for sharing your experience, the experience of you and your son as part of this discussion today. The recording of the BSL talks will be on our website once it's properly up and captioned. So please do visit our website to see the recording. And just finally, I'd like to congratulate Tony Reid and others involved in organising Anti-Poverty Week for once again deciding to focus this week, impacted support this year, on child poverty. And with that, thank you to everyone who's joined us, and please take care for the rest of this week and beyond. We'll see you next time.